I started the neuroaging program for dogs back in 2018. And my intent with this program was to really describe the changes in cognition, the changes in mobility, and then also the changes in vision. I really wanted to be able to quantify those changes, identify key events that are happening, so that we could potentially start to intervene with treatments or with preventative measures.
I came in because my vet had given us a diagnosis of cognitive canine dysfunction. I had noticed a lot of behavior changes in Rufus. He just wasn't himself. He was withdrawn. His appetite had changed. He just wasn't enthusiastic about life. I ran across the clinical trial here at NC State, reached out, and the rest is history.
We're in the middle of running our first big clinical trial, and Rufus was a part of that trial, the star of the trial. Of course, we don't know. It's a placebo-controlled trial. We don't know if he received placebo or active therapy at this time.
I noticed we started the supplement trial, and I didn't necessarily notice much difference in the first month. I think our second visit was maybe after 3 months of supplement, and in that span of time, the change in him was startling.
When a dog is in the last 25% of his expected lifespan, we call it a senior dog. What they do in our neuroaging program is they come in for a general physical exam. They come back for a second day of testing, and that is their play day. They allow us to evaluate their walking speed and things like that. And on day 3, they come back and we do things like the body scan to look at their body composition. We measure their hearing, we look at their vision. So that day allows us to really get some very objective information about what these dogs can do. But what we found is that as dogs lose their hearing, they don't do as well on their cognitive testing. And these are not cognitive tests that require hearing. So it's showing that interplay between, well, different brain functions. A second thing that we have found is looking at how stable dogs are when they stand. We've developed a test where we simply have them stand on a mat and we look at how their body moves and in what direction. What we could show is that as dogs have more pain associated with their joints and their spine, they get more and more unstable. We have a walking test where we're trying to document how quickly a dog walks. Now, we know in people that the speed at which you walk really predicts your mortality. So we wanted to do the same thing in dogs. So our aim is to, first of all, understand what happens to dogs, and then to try to identify treatments or, as I say, preventative things. And we are always looking for dogs that will qualify for the program.
He's a 15-year-old dog and he's back to himself. He greets everybody. I mean, he's into everything he does. He's back to himself. I mean, he's the same dog now that he was when he was 10. It's been a life changer. It gave me my dog back.